Hi, I'm Bela Matyas, Solano County Health Officer. So we've been operating here in the county under modified conditions for quite a number of weeks. And in part that was because of the shelter at home order, but it also reflected the fact that many of us have children, and with schools closed and no childcare, we needed to be able to modify our work in order to also be able to provide childcare. Many people have to care for fragile elderly. Many of us may qualify as individuals at high risk. And so for a number of reasons, we have had employees working from home where possible. And in addition, we have tried to modify the workspace here. We've modified how we interact with clients. We've closed lobbies. We've made a number of changes, introducing cleaners, etc., disinfectants, so that we could operate as safely as possible here in the workplace. As we are moving forward, and we are beginning to relax the stay-at-home order, we need to think about how to phase back to normal functioning here in the county. Now, a number of us have been operating in programs with modified guidance from the state and federal governments, and those guidances have, at this point, end dates, so we need to be responsive to those as we resume normal operations. Philosophically, it's really important for us as we come back to remember that here in the workplace, we need to be able to provide negligible risk of transmission of COVID-19. It's not possible to have zero risk. That's just not possible in this type of a workplace setting. And so what we need to do is appreciate that we will be focusing on negligible risk of transmission. Now, there are a number of things about how we operate that make that a little bit easier. Most of us operate in settings where we have cubicles and or offices, and in those situations, there is no risk, no meaningful risk of transmission from one person to another while you're in the cubicles. Some of us, however, need to interact with clients directly, and so we need to think about how to protect the workers in those interactions. Clearly, we have at one extreme the family health services clinics and the psychiatry clinics where people have to deal with clients directly face-to-face, and we need to use proper PPE to protect our workforce as well as to protect the client. We also have a lot of people that are in the field and visit families, do home visits, deal with children. In many cases, those environments can be controlled. We can call ahead and see if anybody is symptomatic so that we can engage in that environment with some knowledge of what risk we may face. But in some cases, we don't get to control that. And so for the non-controllable scenarios, we need to provide a different level of PPE for our workers than we do for the more controllable scenarios. And then we have the public lobbies, the counters where we interact with the public. And there we need to think about, can we maintain physical distancing? Can we engage clients in a way where paper is passed, but we don't have to directly contact the client? Paper is probably a negligible source of transmitting the virus, but we can add the additional precaution of wearing gloves. So by wearing gloves at the public counters, by trying to physically distance, we are able to employ social distancing in our interactions with the community. Excuse me, that's not perfect, but it's definitely a significant improvement with respect to the risk of transmission. And we can also make sure we frequently clean high-touch surfaces. Among our own workforce interacting with one another, again, we have cubicles and offices which provide physical distancing in most cases more than adequate. But we do have to encounter each other as we're wandering through our buildings, and we're going to have to reconsider some possible changes, maybe one-way aisles, moving in and out of areas in a way that we minimize the necessity of crossing paths, etc. In addition, for people who are uncomfortable and want to, the county has provided cloth face coverings, and those face coverings can be used as an additional measure to protect ourselves here within the workforce. So for those of you who are coming back from telework, you're going to see some changes. We're going to try to keep people more physically apart. We might remove some chairs in conference rooms in order to limit the number of people there. We're going to have clear guidance on how to use the vehicles, on how to interact with our clients. And for those of you who have been working here all along, as more people come back, we need to make sure that we maintain the social distancing approaches that we've been taking. The one thing to take away from this as well is our own personal responsibility. We are responsible for protecting our health and for protecting the health of the people around us. If you're sick, stay home. If you are working around other individuals, be aware of your physical spacing, maintain physical distancing where possible. If it adds a measure of comfort or if it's appropriate because of the nature of the workplace, consider wearing a cloth face mask, and then that can add an additional measure of protection as well. So as we come back, we just want to remember that the disease is still with us. We perform essential services for the public, probably more essential now than before because so many more people need our services. But we can do it going forward while maintaining social distancing.